Hi everyone, Dr. Timothy Gallagher here again at Maragal Medical. This week we're going to be talking to you about treatment options for shoulder pain. As you've heard before, at Maragal Medical, we're an integrated physical medicine clinic and we utilize a team approach. So this week, our medical director, Dr. Michael Marciello, is going to be talking to you about the different types of shoulder presentations that he sees in the practice, as well as the many different treatment options that we have available here at Maragal Medical. So without further ado, take it away, Dr. Mike.
Talking about shoulder injuries today, very common problem that we commonly hear, aches, pains in my shoulder. What do we think about? Rotator cuff problems. Very common. And in fact, so many of us have had rotator cuff issues, but it often gets thrown off as shoulder bursitis or tendonitis. And everyone gets diagnosed with, we have shoulder bursitis. Well, if we think about what is the shoulder and how we have injuries to that joint, we think about the ways in which a group of muscles work around a so-called ball and socket joint. That large ball of our arm bone, the humerus, sits in a socket that keeps it in place. But the socket for a shoulder is very small. It's a very, very small socket such that we may then have large amounts of rotation and movement. And so the muscles and the capsule of the joint have to control that shoulder and therefore allow us to get all these movements without injuries, without problems. But what does that mean in the big world of injury? Well, it becomes that there's many moving parts, many things can go wrong. So when we think about shoulders, and we want to think about assessing your shoulder if you're having shoulder pain, there's a lot of referred issues. The shoulder, commonly thought, is the shoulder itself, as we point to, may be arthritic because it hurts in the shoulder. But rotator cuff pain may refer down into the upper arm. It may give us pain into the shoulder blade. We kind of think about overlap of symptoms of pain coming down from the neck into the shoulder or shoulder coming into the arm. So we have to tease that out in relation to the way in which we examine you. So when we're here at Maragal Medical, we are looking at it from the mechanics of the injury as well as the mechanics of where the pain may be referred to, and we think about our treatment options for that. So let's think about all the problems that can come onto play. Inability to move the arm. The capsule may tighten up, that's called a frozen shoulder adhesive capsulitis. Inability to move the arm because it hurts or don't have the strength to move it because you may have torn a rotator cuff muscle. There are actually 4 muscles that control the rotator cuff of the shoulder. You have an aspect you can't sleep on, it feels tender to touch, don't even want to lie on it at bedtime. Well, that could be a bursitis. And all these things are related to inflammatory processes for which we can then inject it, treat it with anti-inflammatory medications, keep it moving and try to prevent from freezing up, and then we can get mobilization. Move the neck that may be tightening up the trapezius muscle that kind of attaches to the shoulder. So there's so many things that can go on and go wrong with the shoulder. We want to help you. We need to look at it in all different ways to get the right diagnosis and the right treatment. Fortunately, nowadays, there are so many good choices that are not traditional things like cortisone that are done that inject the inflammation, get the inflammation down. We try to avoid, as we may have said in previous webinars and previous discussions, that treatment may cause harm to the tissues. We think about platelet-rich plasma that we've talked about that we could do here at Maragal Medical to try to reduce the inflammation and get the pain down so we can recover it and get the strength back. We all want to have person go back to physical therapy, or we'll give you some exercises, give you some range of motion techniques, because we have to reduce the pain, but we have to regain movement and strength, of course. That group of muscles have to maintain the integrity of the shoulder joint. There's so many things that can go wrong. Don't always want to think of it as, oh, that's just a bursitis, leave it be. Oh, that's a tendonitis. You know, there are many reasons to get an x-ray or get an MRI, or just treat you from the chiropractic perspective of making sure your neck's moving, making sure your shoulder joint's moving. So if you have a question, you're having pain in the shoulder or the upper arm or the side of the neck or even the shoulder blade, that all could be related to your shoulder. give us a call. We'd like to help you out in trying to come up with the right determination of what is the problem. And we'll see you in the office. Talk to you next week.
That was great information, Dr. Marciello. So I think you now have a better understanding of the types of shoulder pain presentations that we see here in our practice, as well as the many different treatment options that we have here at Maragal Medical. If you or a loved one is suffering with shoulder pain, you definitely want to give us a call. Our practice is unique in that we combine medical care, chiropractic treatment, and physical therapy under one roof and have a special interest in regenerative medicine. We always make sure that we take the most conservative treatment options first and utilize as many holistic alternative treatments versus medication or surgery. And I think the biggest point is you want to make sure wherever you're going from treatment is you get to the root cause of the problem. You don't want to simply rely on taking medication or getting a destructive cortisone injection that can lead to more problems down the road. If you like the information you saw today, please subscribe to our YouTube channel. More information about our practice can always be found on our website at maragalmedical.com. Folks, your health is your most valuable asset, and you should be able to access that asset each and every day without limitation. But the doctors at Maragal Medical lead you on a path to wellness. Well, that's it for today. I hope you enjoyed this segment. We'll see you again next week. Have a great day, everyone.